Hi, I'm Dr. Eric Snow, and today I'm going to talk to you about a great product, A-F Betafood. A-F Betafood is made by Standard Process, and when I think A-F Betafood, I'm thinking about gallbladder and liver issues. One of the most common signs of early gallbladder and liver problems is actually burping after meals. When a person has an inability to really metabolize or digest fats very well, it's going to cause trouble with the liver, biliary system, gallbladder, and they will tend to have a burp after they eat. And this can be a telltale sign. We need to get in and we need to feed the liver something like A-F Betafood so we can decongest it. Now, other warning signs of gallbladder problems that are more on the acute side or a little bit more serious will tend to get pain in this right rib margin. Gallbladder patients tend to get bloating after meals, definitely in this upper quadrant there, and that's a sign that that gallbladder is congested. When we don't have the right nutrients, or we eat too much of a processed diet, fatty diet, just heavy type meals and meats and so forth, this causes stress on the gallbladder, and that bile actually gets really thick, and it causes a congestion here. And if it gets too thick and sludgy, your gallbladder, which looks almost like the shape of a fig, it's a smooth muscle sac that collects all that bile from the metabolism of the liver, and the bile will collect in that sac, and then when the food gets down in the intestinal tract, the body actually squeezes that bile out, and you get a bolus basically into the intestine to help emulsify your fat so the enzymes can come in and break them down, and you can assimilate what you need. But when that bile is too thick, that muscle tries to contract, and just like it's difficult to maybe drink a thick malt or shake through a straw, it has trouble pushing it out, those tiny little bile ducts, and it'll go into a spasm, and that's a gallbladder attack. You don't have to have a full-out gallbladder attack, but you can have some light cramping as well. And it's a sign, hey, we need to get in, we need to unburden the diet. Look, where am I getting too many fats, maybe too many oils, bad oils in the diet, and just look at all the fatty things like ice cream, too much cheese, even nuts, nut butters can do this as well. You got to get in there and work on that. So A-F Betafood is a great nutritional support for that. It's made from beetroot and beet leaf, and A-F Betafood has whole vitamins A and whole vitamin F in it, which is a very specific fatty acid. But the reason why A-F is in the product is because it does help to get a little bit more dilation in the liver so we can flush that bile out. Does a great job, I have found clinically, of decongesting the liver and the gallbladder. It's a great source of betaine, and betaine is really the main secret ingredient in there that does so much of this action on the liver. And so when you think of Betafood, a good indicator can be if you are burping after meals, then you need to consider a nutritional support product like A-F Betafood to flush that out, because that means you have poor fat metabolism. And when I think of A-F Betafood, I think gallbladder issues, liver issues, elevated cholesterol, hypoglycemia. When you can get the liver supported properly, have more betaine in the diet, it does help you to convert your fat into sugar, so that can help stabilize a person's blood sugar levels, like in hypoglycemia where the blood sugar is coming down too low. And one of the big things with hypoglycemia is, one, we got to get the sugars out of the diet, the fructose, white sugars, too many carbohydrates, because generally people are going high with a sugar spike and then dropping down. And because of poor conversion in the liver, adrenal fatigue, we can't maintain that blood sugar, and then we go too low in hypoglycemia. And then this is real interesting too. This can be a great support for the person that has elevated homocysteine. Homocysteine is an amino acid that can get to high levels in the body, dangerous levels in the body, because of eating the wrong foods and actually a lack of specific micronutrients like betaine. And what happens when it gets too high, it actually causes endothelial damage. So definitely not a good thing. You take a high stress person on standard American diet and their homocysteine levels are going high, you're at really high risk for heart attack, stroke, because of the way it creates inflammation in these vessels. So basically the betaine converts the homocysteine to methionine so it doesn't build up in the blood and cause damage. And I use A-F Betafood a lot just to flush the liver out. We can get toxins out through the bile route. And there's another product called Betafood, which is the base of A-F Betafood. Now, I use Betafood more for long-term support. So you have the person and they're starting to get stones in the gallbladder. We have all these indicators of just gallbladder issues and liver congestion. Or maybe we have a homocysteine case here. Then I'm going to consider the Betafood for a more long-term support. Well, I hope you learned something today. If you want to get your bottle of A-F Betafood, just look in the description box below and we'll have a link there for you to click on. And if you have a health concern that you think we could help you with, feel free to give our office a call, 337-478-1313. Like our videos and subscribe to our channel. I'm Dr. Eric Snow, helping you transform your health naturally.